Good evening, and welcome to Community Immunity. This one, we are focused on, we got a Georgia state of mind tonight as we are focusing on the state of Georgia. This has been a series of Facebook Live discussions as we've been talking about vaccine acceptance rates, vaccination acceptance rates in areas where there has been low vaccine acceptance, particularly by Black and Brown members. And we want to just get an understanding as to why. And so what we're going to do is we're going to take the national discussion about COVID and vaccines, and we're going to make it local. And so if you watched us before, we have been gone to Mississippi, we've gone to Alabama, we've gone to Louisiana, Texas, South Carolina, North Carolina, and tonight we are in a Georgia state of mind. So we've got a wonderful panel of local physicians here to talk about what's happening in the state of Georgia and to give you a robust perspective of what's going on. So we've got the president of the Atlanta Medical Association, we've got a psychiatrist, we've got a pediatrician to kind of talk about what's going on with vaccinations of the kids, and we've got a cardiothoracic surgeon to talk about why aren't you getting your heart stuff because you've been afraid to go to the doctor because you've been worried about COVID. And so we're going to get you over all of that. We're going to give you some perspective, and we're going to give you some factual information about what you need to do to go ahead and make an informed vaccine decision. So first thing I'm going to say to you tonight before we get into the statistics is let us know where you're watching from. We'd like to drop that in the comment. Let us know where you're watching from. Share this with a friend that might need this information if they are on the fence with regards to getting vaccinated, particularly here in the state of Georgia. We want to make sure that we give them the information and they hear from local representatives and doctors. And we have a local citizen. I don't want to leave out our local citizen to talk about her particular experience. So we're going to go from national to local, and we're going to give a broad discussion of the topic of the vaccines. But I want to kind of give you where we are. So right now in Georgia, there have been 8.45 million doses administered and 3.9 million people are fully vaccinated. What does that mean? That means that 36.7% of Georgians are fully vaccinated, which is below the national average. 43% have received one dose, and again, that is below the national averages. As far as Black residents, when we bring it home to Black residents, 26% of Black residents have had at least one dose, and that's not even a million people. That's about 867,000 Black Georgians have been vaccinated, and I would say probably most of those are in the city of and around the city of Atlanta or our major metropolitan areas like Atlanta, Savannah, and Macon that are probably the bulk of those vaccinations. And so what does all that mean? What do those numbers mean? And what's the implications of them going forward as we continue to move through the summer, as we see everything is opening up. Restaurants are opening up. We're talking about in the fall, football season. Mercedes-Benz Stadium is going to be fully open. And so what does that mean in terms of COVID rates, people getting sick, people getting hospitalized, and people possibly dying? What implications that has? So I'm going to stop talking because I know you didn't sign on. You're not here to hear me talk. You're here to hear our experts talk. And so our first expert this evening is Dr. Kevin E. Woods. And let me say something about Dr. Kevin Woods. Dr. Kevin Woods is so accomplished. We could spend the entire show talking about what Dr. Kevin Woods has accomplished, but I'm going to give you some of the highlights. He is a Morehouse man, undergraduate, and he went to Meharry Medical School, which is one of the four historically Black medical schools in the country. That's Meharry, Morehouse, Charles Drew, and Howard. I got to know those off the top of my head. And he is also the president of the Atlanta Medical Association, and he is also the president of the Georgia Gastroenterologic and Endoscopic Society. Welcome to the program, Dr. Woods.
Thank you.
Did I say all that properly? I just
You got it all in. You got it all in. Thank you.
So when you hear those, first question is, when you hear those numbers with regards to not only the vaccination rates in the state of Georgia, but the vaccination rates of Black people in the state of Georgia, what are your first thoughts?
Unfortunately, many of these rates just highlight the fractures in the U.S. health delivery system. And it really just has brought, as we all know, the overwhelming disparities in healthcare that our Black and Brown communities have been suffering from for decades. And it really does. And this unexpected and god awful time that we've gone through as a world just highlight that we have a lot of work to be done and it just tells us up front that there's so many different things at so many different levels affecting our community, and that we need to do something about it.
Absolutely. Well, I completely agree. I think, so do you think it's become more of a political issue? Do you think it's something more about infrastructure that we can't get to the more rural areas of the state? Or, what do you think that's causing some of this delay in terms of getting vaccinated here in the state?
Well, I think it came in many different phases. Obviously, politics has not been absent from this discussion,
Yeah.
but I think that over the time that we've gone from not having a vaccine at all to using what I would say is just common sense practices, from a sense of masking or washing your hands and staying away, in a sense of social distancing from large groups. But what was highlighted early in the pandemic is that many Black and Brown communities were frontline workers and did not have the opportunity to really take advantage of some of these privileges that many Americans were able to take advantage of by, again, staying out of the public at a time where we had no vaccines that could help decrease the risk for infection and also death. I guess the second major issue that I think has highlighted some of these questions are deep-seated trust issues with healthcare and healthcare delivery, which of course has been covered widely in the news, around the trust in the Black community around mass atrocities that occurred in our communities. Obviously, the Tuskegee experiment is probably the most widely known
Right.
of those, but as we think about the Gila cells with Henrietta Lacks is another kind of popular culture, made popular by Oprah's movie and also by the book. We have many examples, unfortunately, of where healthcare and ethics in healthcare has fallen short for people who are Black and Brown. So not to really highlight that. I know we have a great panel tonight to talk about those different areas. But again, I like to, as on behalf of the president, as president, on behalf of all the doctors in Atlanta, part of the Atlanta Medical Association, we spent a lot of time with forums and also discussions in the communities at churches and also civic groups, trying to really understand this. And what it really comes down to is having a relationship with the healthcare community, if that's through your physician or even through folks in your community that are able to talk about some of the myths that have been spread. Can't just blame it on politics. It does come down to getting the facts. And so hopefully today on this panel, we'll be able to do that.
It's interesting you bring that up because that's been kind of if there's been one common theme amongst all of these southern states, is that trusted sources is very important. And some of those trusted sources aren't wearing white lab coats. They are the conversations that are happening in the barbershops and the beauty salons that they're getting from their friends and families and neighbors. It is coming from the pulpits where the pastors are passing down that information because they say, I see pastor every Sunday. I might see my doctor once a year if I'm going for my regular checkups. And so I think sometimes the people that are most familiar to them are the ones that maybe have their ear more than especially somebody that may be coming in from outside, whether it's the National Guard or whether it's, another medical professional to come in and say, oh, you need to get vaccinated. Like, I don't know you. And that's that's kind of the southern sensibilities that we learned over the years. And so I think you're right. It's important to kind of have those public-private partnerships that will help get the messaging in to the right messengers so they can be delivered properly versus just us trying to wag the finger of judgment and say you need to get vaccinated. So let me ask you this. What impact has COVID had on your practice in particular?
Great question. I'm a gastroenterologist, and
What does that mean? What is a gastroenterologist?
a gastroenterologist is a doctor that specializes in digestive diseases. Many of us come to know a gastroenterologist when we have heartburn or abdominal pain, or in some cases rectal bleeding. But one of the key areas that we've seen, as many of us saw the closure of what we will say is non-emergent or what we say is scheduled outpatient procedures. So we saw a decrease and the utilization of those services, because we needed to make sure our healthcare system could react to the overwhelming need for hospital beds and resources for those that were being affected by COVID. So from specifically as a gastroenterologist, we saw people not getting screened for colorectal cancer, which unfortunately in the US is the number 3 incident cancer, meaning is under breast cancer, first lung cancer for all Americans, then breast cancer is number 2 for women, prostate cancer for men, and then the third leading incident cancer is colorectal cancer. In the state of Georgia, this is important because it's the number 2 cause of cancer statewide, and unfortunately the number 2 cause of cancer deaths throughout the United States. So not getting those opportunities to screen our patients, we're definitely seeing patients coming in now with disease that may be outside of a cure, right? Outside the ability to detect it early. And that lack of having an opportunity to come in to be screened has definitely been an impact that we've seen from that service line for sure.
Absolutely. So how has it improved since the vaccines come down? Have you seen an uptick in people coming back, or has it been slow in terms of getting people back into getting screens, getting their doctor visits and whatnot?
In the metro area, for sure, we're starting to see a rebound in patient visits. I think as vaccines have been made available to the public, of course, the medical community was the first group to be prioritized, along with our elderly and patients that had chronic conditions. We've seen patients have a lot more faith in the process of coming into the hospital and knowing that they will be protected and not be at a higher risk of contracting the virus. So for sure, we've seen with vaccines, we've seen an increase in comfort and trust that they can move safely without being put at risk.
Absolutely. So what are your, I know you don't have a crystal ball. If you did, you'd be a very rich man, because you just got to look into the future, see what's going on. But I would just say, what does your gut tell you in terms of, like, as we get, as the state has really been opening up more, as we move into the fall, which we know we're getting inching closer and closer to flu season, and I say flu season, but flu season is that area of the year where viruses can tend to flourish and tend to spread a little bit more than they do in the warmer months. And so what is your prediction in terms of where you think we'll end up in the next couple of months?
Well, I don't have a crystal ball, and what I will say is that COVID-19 is with us to stay, just like many other viruses that are now in the community. So I don't think it would be too crazy to try to predict that if we fall away from some of the practices that we've now seen as common, that used to be uncommon, with wearing masks, not touching our hands in our mouth, and making sure that we are using hand sanitizer and cleansing spaces. That for sure could potentially lead to an increase in uptick for those that are not vaccinated, given that we have such a low vaccination rate. As we've learned through our public health officials and, of course, through our government, that getting to herd immunity requires a large majority of the population to be vaccinated.
Right.
It for sure in Georgia means that we are at higher risk for having complications for those that are not vaccinated. So the good news, though, is as we look at the current county data, is showing a decrease in many of our metro areas in the most densely populated portions of Georgia, where we're not seeing an increase in hospitalizations or deaths. We're actually seeing a decrease. So I'm not sure we know enough of why that's happening. Obviously, we're very happy to see that, but as we all are hearing about the pathophysiology of this disease, and we're learning more about it, meaning how does it actually impact us as we learn more every day. I'm sure that we will learn some things, meaning that nobody will know until it happens if this is going to be a bad problem for us coming up in the next winter season.
Now, I'm curious, and I know this is not COVID related, but I'm curious, is that when you're talking about the cancer and the prevalence of colorectal cancer, is there a site or something that people can go to learn more about it, to learn about screenings, when they should be getting screened, things of that nature? Is there some materials or something that they can check out?
Sure. I mean, there are a number of organizations that, both from a public or, say, nonprofit perspective, that talk about it. Screenforcolorectalcancer.org You also have the American Cancer Society that has great website for the general public to talk about risk factors of colorectal cancer. For the patient or families that have been affected, we have Fight Colorectal Cancer, which is also an advocacy group that does a really good job of explaining what the risk factors are if you or a loved one have been affected. So those would be some of the websites that I would like our viewers to go and learn more about colorectal cancer.
Absolutely, absolutely. We'll definitely, hopefully, as we get through this pandemic, we'll be able to have more programs specifically about colorectal cancer and other illnesses that are affecting our population. Because we've got it, COVID has kind of sucked the air out of the room, so to speak, with
Yeah.
regards to other illnesses, and they're being exacerbated across the board because they're not getting treated early enough and not being detected early enough in order for it to be treated properly. For our population, specifically for our population that has a historic kind of mistrust of medicine, as it is, as you talked about earlier. So we've got to do a better job, but the first thing we got to do is get COVID out of the way. And that's where we're hoping this program will help go away in terms of getting COVID out of the way, so we can get back to what our normal medical routines would be. So thank you for joining us. So Dr. Woods, I want you to stick around because we're going to do a panel discussion at the end. So hang on. We got to move on to our next guest. Which is Dr. Samira Brown, and she's not a stranger to blackdoctor.org. You have seen that lovely face on here before, but she is a board certified pediatrician. She is an active member of the NMA, and she also has a company that makes face masks for children. So she's like, look, stop putting those bad face masks on your kids and thinking it's going to protect them. Your bonnet is not going to protect your child from getting COVID. You need to put a real face mask on your child. And Dr. Brown is gracious enough to be able to create a company to do just that. So welcome to the program, Dr. Brown.
Thank you so much for having me, Ellis.
So, as you know, the big news is that Pfizer has been approved for use down to the age of 12, and they are working diligently. And some of the other companies, not Moderna as well as other companies, are working to try to get approved to age 12 and even younger. What implications do you think this would have on as we approach? I know it's summertime, kids are, they're in camps, but what implications do you think this will have on school as we approach the fall?
So, this is definitely, a huge sigh of relief for us as pediatricians that we now have a vaccine that can prevent COVID, right? So this is bread and butter pediatrics. This is absolutely what we do. And so really, if your child is 12 and up, then we definitely want to make sure that they get fully vaccinated before they go back to school. And right now, Pfizer, you're right, is the one vaccine that is approved in that age group. And it does take 2 doses that are going to be 3 weeks apart. And we also want families to know that it takes 2 weeks after that vaccine when you have that full antibody protection. So it does take even a little bit longer than those 3 weeks to get that full protection. And there have been 7.7 million doses of Pfizer given to teenagers already. There have been no major side effects. And so we definitely encourage everyone, that's certainly the safest way for kids to go back to school is vaccinated if they're age appropriate.
Okay, so I'm going to challenge you just a little bit because I have been reading something about something with the heart in kids and vaccines. So I know it's another one of those fancy words that I didn't practice before we got on the show, so I'm not going to try to say it. But I know you know what I'm talking about because I can see.
I 100%. I definitely do. So myocarditis.
Okay.
Is an inflammation of the heart. And you've also heard about pericarditis, which is an inflammation of the sac that surrounds the heart. Okay. And we definitely have seen myocarditis likely associated with this type of vaccine, the mRNA vaccine. Okay. And we want folks to really understand that myocarditis and pericarditis that is occurring with the vaccine is mild.
Okay.
They get better with over-the-counter medicine, ibuprofen, naproxen. Those are non-steroidal anti-inflammatory drugs that we use to get them better. And then the other piece of it is that it's extremely rare. So if you are a male, it's a little more common. So it's 32 cases out of 1 million.
Okay.
If you are a female, it is 4 cases out of 1 million currently is the rate. So
Okay.
it is absolutely mild. And myocarditis is something that we can see from other viruses. And COVID itself, the infection, the natural infection of COVID, also causes myocarditis in a much more common and much more severe way. So it definitely is safer to be vaccinated. And myocarditis is something that we treat and diagnose in the office same day. So kids can present with chest pain, they can have fever, shortness of breath. Sometimes they're going to say that their heart is skipping beats. They
Okay.
come in, we get an EKG right away, we do labs, and we can tell right away if they have it and get them right onto treatment. And usually within a day or two, they're feeling better. And all of these kids did extremely well. And within a few weeks, they were doing great. We do follow them for about 3 to 6 months, just standardly for all cases of myocarditis with a cardiologist, and we do restrict their sports activity. But again, it's mild and it's very, very rare.
Okay, so it's mild and rare. You treat it right away. You listed the symptoms, and it's more common in kids that have contracted COVID than kids that have been vaccinated. That's the layman summary of what all that fancy stuff you just said. So,
You
um, I paid attention a little bit. So, there is also the other kind of elephant in the room is the Delta variant. And so, and we're not talking about the Delta Sigma Theta variant. We're talking about the Delta variant. What can you tell us about the Delta variant in general and its impact on children specifically?
So it certainly is something that we're very concerned about. It is 60% more transmissible than the current, strain that is dominating in the U.S. We do think that it is going to become the new dominant strain, and this is what viruses do. They change over time. This is not something that we don't necessarily expect. And right now, the vaccines are protecting against this variant. And so we're seeing that these rates are doubling about every 2 weeks here in the US. And so we're not sure exactly if this is more contagious in kids, but it is certainly something that we are always looking at, and also to see, is the disease going to be more severe in kids or adults? It's something that we're always going to keep our eye on. But the most important thing is to get vaccinated to protect us from this Delta variant.
Absolutely. So my final question for you is why do you think people are more afraid of the vaccine, for lack of a better term, I'm afraid of the vaccine than they are of contracting COVID?
I mean, as a pediatrician, we deal with vaccine hesitancy on a regular basis. The health of your child is absolutely vital. You want to make sure that you have had all of your questions answered. You want to come talk to your pediatrician. We're going to be transparent about what we know and also what we don't know about this vaccine. And so I think it's okay to be hesitant. It's okay to have questions, because that's what we're here for as your pediatrician, to answer them for you so that you can be comfortable. We're not here to judge your decision. We're here to give you all the information that you need to make a comfortable decision for your family, and also so that you know how to protect your children the best that you can. So I think that it's okay to have questions. This is something that is new to families, and this is the first time a lot of our society has seen what really happens with a vaccine coming new onto the market. So I think it's great to get the kids engaged themselves, let them ask questions as well, so that they can learn to be advocates for their own health.
Why we could talk about kids all night, because I've got my I'm very, very curious about this, but I'm going to stick a pin in that because we've got some other guests we want to get to, and we're going to come back around. So stick around for me, and when we get to our panel discussion, we may have some more questions. And also, I want to encourage anybody that's watching right now, if you have any questions, particularly about kids and vaccines, we've got Dr. Brown here. She is one of the best here in the Atlanta metro area. So please put your questions in the comment section, and we'll get them asked to Dr. Brown later in the program. Thank you, and we'll see you shortly, Dr. Brown. Next up, we're going to bring on Dr. William Cooper. He is a cardiothoracic surgeon. He is an author, public speaker, as well as he's been in the media a few times himself. Take yourself off mute there, Dr. Cooper, and thank you for joining us.
Thank you, Ellis, for having me, and I appreciate the opportunity to come in and spend some time with you and your audience.
Thank you. So one of the things I learned as I've been kind of reading, I try to read the layman's, nomenclature about COVID, but I did come across an article at one time that talked about how initially COVID was thought to be a respiratory illness because people were going on respirators. And I remember early in the process, respirators were going out. But now some of the research I've been reading has said it's more vascular. And when you're talking about a vascular illness, that brings the heart into play. Could you talk a little bit about that in terms of what that means to have a vascular illness versus a respiratory illness?
Yeah, so here's the way to look at that is COVID, and the way that COVID is so deadly. It's not that COVID in and of itself it has some nuclear weapon or something in its back pocket that's just really destroying our bodies. It's not that. What COVID has done, because it is novel, meaning it has never been introduced into the human species, at least this particular variant, it creates an inflammatory response in the body.
Okay.
Okay, and that inflammation. So the prior guest, Dr. Brown, was just talking about myocarditis. Is a response to, in most cases, the spike protein on the surface of the virus itself. Okay,
Okay.
because guess what? Our bodies have never seen it, and they're fighting like hell to get rid of it. And in so doing, it puts out a number of things that are naturally in our bodies to respond to infections in a much more aggressive manner. And so, in some people, that response, in fact, that's the thing that leads to death in people with COVID is an overwhelming inflammatory response. You may have heard early on there was a lot of talk about using steroids and dexamethasone to try to abate that inflammatory response to some extent.
Right.
Now, why in the lungs? It would manifest itself in the lungs first, because guess what? All of the blood that our heart pumps goes to the lungs, and the lungs act as a big, huge filter for everything that comes out. And you imagine you're breathing in, and then you've also got blood flowing into the lungs from the pulmonary arteries. And all of those inflammatory cytokines, interleukins, and other things that are basically spewing out to try to fight it, it comes in through the respiratory system. So it's sort of meeting on the battlefield, if you think about it. So COVID is meeting all these things on the battlefield, and the battlefield is in the lungs. But as you stated, it has a profound effect on the entire vascular system. That's why we see myocarditis. I personally have seen in the last year and a half more clots, what we call deep vein thrombosis or pulmonary emboli, than I've been doing this for a very long period of time. I've seen more in the last year than I saw in the prior 10 years.
Oh, wow.
That's clots, pulmonary emboli, DVTs, clots in the lower extremities. And it's because of that inflammatory damage that's done to the intravascular system throughout our entire bodies.
So that sounds, when I'm thinking about those illnesses that are predominantly, that affect a larger percent of African Americans, hypertension, diabetes, the big two, that interplay seems like it could be a deadly combination and could be the reason why there has been a higher death rate among African Americans that have contracted COVID versus other ethnic groups.
It's very, very complex. It's a very, very complex interplay of a number of factors. One is, yes, we know that African Americans, people of Latin and Hispanic descent, have a much higher burden of hypertension and other vascular related diseases, heart disease, diabetes, et cetera, et cetera. Those things have already created the foundation of an abnormal interplay of inflammatory mediators on a daily basis. Vascular disease in general is an inflammatory condition. And so now you layer on top of that COVID and this exaggerated response that we see with COVID. Now you've got sort of the double whammy of that. And I want to just mention one thing. I want to mention something that Dr. Woods said earlier. And it's important. There's so many subtle little things that happen in terms of people not, we want to talk about, African Americans and our communities not trusting. We trust. We got plenty of trust. The healthcare community needs to answer this question. Why should we trust you? Okay. Why should we? And that's the burden of the healthcare system in this country, is to get to a point where we're very comfortable having that conversation. Now, why is that important? So there were actually, during the height of COVID, and even now, you can go out and look this up, Ellis, there are a number of studies that were looking at how we triage and how we decide, quite frankly, in an acute care setting, who's going to get the maximum amount of treatment for COVID? Who's going to get the ventilator? You imagine the systems were really, really stressed. So did you know that there were actually critical care indices that were created that basically, if you came in with a higher burden of hypertension, diabetes, high cholesterol, obesity, you were considered so high risk that perhaps you were not the one who got the ventilator. So how did what was that interplay with that quote triage system with these higher death rates in people who are already much more vulnerable? So the little subtle things that these little subtle indices and things that we put in play, acuity indices that we think are really manifesting or really doing good for our resource allocation, but they're actually in and of themselves creating another whole area of inequity and disparities, and perhaps even contributed to unnecessary deaths during the height of COVID.
Wow, that's a lot.
I just blew your mind, didn't it? Yeah, I know I did. Yeah,
you did.
When you get beyond, we cut it beyond the surface and start talking about, okay, well, these people have a higher burden of X, Y, Z. So what are we doing about it in our healthcare system? Okay. And that burden, quite frankly, in my opinion, is on the healthcare systems, not necessarily on this whole, we focus so much, how do we get you to trust us? Hell, why the hell should I trust you? Okay. You've given me no reason. Okay. I can give you 1,000 reasons. Henrietta Lacks, Tuskegee, Marion Sims, who committed some of the worst atrocities ever in women slaves with no anesthesia, and created procedures that we're still using today, was considered the father of obstetrics and gynecology in this country. And we're praising this man, and he was a murderer. And so these are the kinds of things that we need to begin to understand in the healthcare system. Right. And guess what? Our people of color understand it very well. So we have not given them a reason, quite frankly, to trust us. So why do we think that people are not going to take this vaccine? They don't trust that. So the burden is on us to change the narrative first, but secondly, be very honest, intellectually honest and professional, and be willing to have real open, honest conversations about these problems. And then we'll begin to engender trust in people. And then they'll go back to the doctor and start to look for real answers and real help for themselves so that they can transform and live long, happy lives.
Well, I'm
sorry to blow you up.
I love this because it's all about perspective, right? And so absolutely a different perspective in terms of looking at it, because and I'm not a doctor, I'm not a doctor. I'm working in media, but what we've always kind of been that one way focusing, hey, we're the doctors, we're bringing you the information that you need. You need to listen and trust us. We've got to give you a reason. You're absolutely right on that.
And then here's the other thing. A good friend of mine a little while ago was drinking a Coca-Cola and just said they needed a little bit of energy. And what I wanted to say to that good friend, I use this as an example with people who talk to me about the vaccine. Do you know what's in that Coca-Cola?
A lot of sugar.
Okay, there's a whole lot of other stuff in that Coke, and don't get me wrong, I don't want Coke coming after me. I have good friends with Coke. I don't necessarily drink Coke. I got no problem with people who want to drink that. But if you look at the label on a lot of things that we put in our bodies every day, no one out there can tell me that they absolutely know everything that's in that. But yet we have this suspicion about microchips and all these other things being in a vaccine.
Right.
And okay, where's the disconnect here? I mean, you're taking and eating and doing all these things. You have no idea what's in that. And yet and we have data over here to show that this is actually reducing the chances of getting infection. And also, if you get it, reducing astronomically your risk of dying related to COVID.
Right. That this has been a wonderful. I was like, man, we got to have this again. We got to have. But I need you to hold on, because I got a couple.
I'm here, man. I'm here. I'm not going anywhere. I really enjoyed the discussion with the other panelists. Thank you so much for having me.
Absolutely. Thank you, Dr. Cooper. Wow, he just blew my mind. He turned my black beard white just at that one moment, at that one short conversation. But we got another guest. So just stick around. We got another guest here. We're going to bring on another person that's not a stranger to Black Doctor, and that is Dr. Erica. Her last name was Goodwin, but she goes by Dr. Erica because she is a double board certified psychiatrist. And what that means is she is certified to treat both adults and children. And she also is a podcaster. What is the name of your podcast? Is that it behind you there?
Better with Dr. Erica.
Better with Dr. Erica. So check it out. She is on the Apple podcast site. So I know you're probably on other sites as well, but I know you're on Apple because I listen to it myself. And it is a wonderful, wonderful podcast. And it's very, very thoughtful. And so please go check that out. So that's a shameless plug for Dr. Erica. I did it. So y'all blame me for that one. But Dr. Erica, why are we having a psychiatrist? So one thing is, why are we having a psychiatrist on a show about COVID? Well, there is a mental aspect to everything that has happened over the past year and a half. We went from business as usual, going through life, kind of sailing through life as we normally do, to putting the brakes and having to do a full stop on society and go home and bring our kids home and try to homeschool and try to figure out and worry about every time we go outside, are we going to catch COVID? That is stressful in a already enough stressful in terms of, just being Black in America is stressful enough. Then we added another layer to it. What does that mean in terms of our overall mental health, having that full stop and then having to make such a dramatic change in our lives?
Well, thank you. Number one, thanks for having me. I just really appreciate it. And I really appreciate the fact that you all are so thoughtful about topics like this. And one of the things that's huge about mental health in COVID is the fact that there's been a significant uptick in mental health symptoms with COVID itself. You have people presenting and complaining of anxiety and depressive symptoms that didn't have them before, or they were very low level and then they become higher. There are some surveys where they're showing up to 40% of respondents are saying that they're experiencing significant anxiety or depression. So the first is just that people are symptomatic because the environment itself is stressful. People have had to deal with a lot of change. This season has been filled with a lot of loss, along with the realistic fear of there being an infectious disease out there that can particularly kill people, along with the fact that when you talk to a lot of people that have had significant COVID illness, not even just the ones that have been intubated or in the ICU, is something about feeling like someone feels so sick they might die is traumatic. So the experience of having COVID itself is traumatic, along with the fact that there have been some potential COVID-related mental health problems.
Well,
That was a lot.
absolutely. That was a lot. But I think you're making a good point. So talk about the flip side of that. Now that the vaccines are there, now that the vaccines are available to people, talk about how that could potentially help our mental state, if knowing that, hey, we are potentially protected and potentially protecting the people that are around us, our loved ones, our friends and family, by getting vaccinated.
Well, I think you bring up a good point, which is the fact that there is some level of stress reduction from getting the vaccine, especially even if you're not necessarily someone that gets the vaccine is like, I'm out, because we're in Atlanta. People are just out. They're out in Atlanta. But just the safety of feeling that your bubble can expand, or there are people that now feel safer visiting or spending time with elderly parents or relatives that prior to the vaccine, they felt like they couldn't necessarily be around. So just the fact that it allows for more connection is huge from a mental health standpoint, for people to be able to have some human contact, where before there was such a level of physical distancing that a lot of times people didn't feel comfortable being around people. So I do think it's huge as far as some of the stress reduction, and then being a situation where it allows more connection and human interaction.
So I asked this to one of the doctors earlier. What impact has COVID had on your practice?
I see a lot of people coming that never saw a mental health care person before. So it's people that weren't seeing anyone before, were doing okay. If they were a little stressed, they're a little stressed. And this whole experience of COVID as a whole has tipped the scale. So on one end, I'm seeing people struggling with mental health that never had difficulties before. And then the other group of people I'm seeing are people that had experienced significant trauma, being significantly re-traumatized from the experience of COVID itself. So their PTSD symptoms are spiking and going up tremendously.
Wow. Okay. So I won't say it's been good for you, but I think that's a challenge that you have to deal with. And then you also have the additional challenge of now moving from, hey, I have to go from in-person to virtual in terms of counseling, and talk about that. How has that worked for you in terms of, is it better or worse? How's it worked out for your practice?
Honestly, out of all of the fields traditionally for physicians, our field was the most made for it.
Okay.
Psychiatry was made for virtual because we don't technically have to touch people.
Right.
So we already are in an environment where it just transitions well. And the other thing is, for a lot of us, since there's a significant shortage in psychiatry, by going virtual, you actually increase access, except for the population that just doesn't have good internet. And that's a whole other conversation as far as access to internet infrastructure. But for the average person, all you need is a smartphone, a tablet, or a computer. And then you can have an appointment where there are people that had significant transportation issues,
Right.
or you were in an area where there weren't that many people that either took your insurance or weren't close to you, that now you have access to a plethora of people. So on that end, I think it's totally changed the way people can access us, because
Right.
since there was a shortage, you couldn't always easily get to one of us. The one thing that's probably been just a little bit trickier is a lot of stuff has stayed in person when it comes to what we call acute care. So that's
Right.
when people are really sick, like they're super depressed or they're super anxious or they're psychotic or they're having manic episodes. Those kinds of things typically are still handled best face to face, but there are a lot of things that we've been able to handle better and handle very well through a virtual platform. So for me, I've been surprised. I wasn't as much of a fan until I did a lot of it, and I realized that there's a lot you can do in those platforms than it felt like before I tried it.
All right. So last question for you before we move to our next guest. And that is, what is I know I asked Dr. Woods this earlier, crystal ball, what do you think is going to happen in the future in terms of, are we going to continue to move towards herd immunity and get better as a country and a community? Or do you think it's going to be, turned in the opposite direction and we'll have another spike because of the lack of a vaccination uptake in the southern part of the country?
I'd say I'm cautiously optimistic,
Okay.
but
All right.
my gut says that, number one, we know we are nowhere near over. Number two, viruses are tricky. Viruses are very smart. So as we're
Right.
having these more contagious variants, there's just more room for it to spread and for there to be difficulties. So I feel like it's one of those things that at some point we'll get to herd immunity, either because enough people got vaccinated or unfortunately a significant amount of unvaccinated people just didn't make it. I mean,
that's a reality. No.
It's just a reality as far as dealing with this. And I think the hard thing is I remember I had a conversation with my cousin. My cousin's like, there's got to be something else. And I think that's been the hugest challenge. And one of the things as a health professional we've had to talk about is there are preventive things that we all do to keep our health at its highest level, to keep our immune systems at its highest level and our bodies functioning at its highest level. But none of that will necessarily 100% prevent you from getting an infectious disease that is this smart.
Right.
And unfortunately, right now, we have a limited amount of tools in our toolbox to try to prevent or head off COVID. And the main one we have is this vaccine, which is why a lot of us are so invested in people becoming vaccinated, because we just don't have a lot of options. I wish we had more options for people and we could say you could do this, or this, but this is kind of what we got.
And I know I said that was the last question, but I want to touch on something that Dr. Cooper brought up. I thought was a great point, is how do we, and I'm saying we as a medical people that work in healthcare and or around healthcare, how do we get the general population to trust us? We're just demanding that trust and we're not trying to go get it. How do we get the general population to trust us more, to say, hey, what we're giving you is actual and factual, and that's going to really help you, even though you've got documented history of mistrust and distrust. We're really on the up and up here. How do we get them to do that?
I think the first thing is, as people that are advocates for healthcare, is that we have to stay emotionally neutral. because it's very easy to be in situations where you're having these discussions with people. They have a different perception, and it's very easy to get triggered. So I think the first thing is being able to have the patience, the kindness, and the grace with these types of conversations, that for some people, the amount of proof they need and time they need to get that proof, to feel that something bad isn't going to happen to them because either the country's still racist and, this vaccine is a way for us to get you,
Right.
or just because the concern of still a lot of the concerns around, is it really safe? Is that there's going to be time. And the thing that's difficult is being able to sit and be patient with people while they take the time they need to be able to process the information to come up with a decision. And the other is being able to respect that there are going to be some people that no matter how much data they have, they're not going to feel comfortable with it.
Yeah.
And being able to accept that enough that it doesn't become so emotionally distressing.
Right.
Because people still have choice.
Yeah.
And we're trying to counteract hundreds of years of data of people doing us wrong.
Right.
It's not like this is 1 year of Black people being done wrong. You're trying to look at 100 years worth of hundreds of years of programming. And it just happens to be that this issue is so critical that people that really have an understanding and are comfortable with the science are very passionate about it, because at the end of the day, we all went into medicine because we want to save lives. We want to make people's lives better. We want people to have the best quality of life. You can't have that quality of life if you're dead, or
Right.
if you end up with long haulers or some significant symptoms that last past your initial infection, and then you can't live your life and you have horrible quality of life. And I think part of the reason we're all so passionate, and one of the things I'd like your audience to understand, is one of the reasons we're so passionate with you is because a lot of us get a chance to see behind the curtain and see what is best case scenario and what is worst case scenario. And we just don't want worst case scenario for you.
Gotcha. Well, thank you for that, Dr. Erica. Stick around. We got one more guest, and then we're going to bring everybody back, because I have some questions about long haulers. There's so many stuff that got brought up here. I know I told y'all an hour, but y'all been too good. Y'all are too good. I got too many good people on there. So our last guest is Miss Joy Stevens. We don't make sure y'all mute yourself there, Joy. Joy Stevens is an Atlanta resident, and we wanted, as with this program, we wanted to bring on private citizens. She is a diversity and inclusion consultant, owns her own business, and so she's out there. Like she sees she consults with a lot of companies. She sees a variety of people, and so you kind of know what's going on in the area. So, Joy, welcome to the program. Thank you for joining us. And my first question is, what was your experience with the vaccine?
Well, I would like to say, and I think I believe that my experience with the vaccine was pretty straightforward. I was never one of those people that got the flu shot every year. Okay. I will tell you, I think I got my last flu shot until recently in college, and I got the flu shot and I got the flu, and I said, never again, not doing it. I'm going to just wash my hands the way we're supposed to wash our hands. And because during the pandemic recently, I had to shift from doing in-person seminars and workshops to virtual. So I was working from home from day one, and I live alone, keep my hands clean. I had Lysol and sanitizer everywhere I went. So I felt relatively safe, but I had a checkup with my doctor, and she asked me, was I going to get a flu shot? And I said, no, I never get a flu shot. And the look she gave me was so defeated. And she didn't say anything. It's just her whole face was like I could see in her face, don't be another problem, Can't just one of y'all just do right. So I thought to myself, you know what? It's not like the flu shot is toxic. I mean, people do it every year. You have different strains every year. You get it. So I got it. So I wouldn't be one more person in her office in the midst of a pandemic. It was fine. Nothing, no big deal. So then when the vaccine came available for COVID, I heard the things I understood because I do. Every time I do a diversity and inclusion seminar, it includes a historical aspect. So I am up on my history. And so I
Right.
was trying to explain to people that the Tuskegee experiment was not infecting Black men with syphilis. They left them untreated. That's a very distinct difference. They
Right.
weren't shooting them up. And so trying to explain that to people and understanding myself, I had no major qualms about getting the vaccine. I think another aspect of this has been, this was the first time a new vaccine came out in our lifetimes, really. The flu doesn't really count. It's kind of new. We do it every year. You know, oh, this year is H1N1. This year it's that, the bird flu, blah, blah, blah. You're used to it. This was something new. It was a novel, right? Coronavirus. And a lot of people, you don't remember when they developed the polio vaccine. You don't
Right.
remember when they developed the MMR vaccine. That's just been here your whole life. And now
Right.
here's something that they want to test on you. So I understood a lot of people feeling some type of way, but you know, I was up on my reading. I understood the difference between the way this vaccine, the doctors involved with creating this vaccine versus, we'll say, times past, where
Right.
it may have been a very homogenous group of people, you know.
Right.
Maybe not everybody taken into account. A whole lot of lives didn't matter back then.
Right.
So I felt good about taking it. I got the, is it okay if I say what type of shot I got?
Yeah, that's fine.
I got the Pfizer shot because it was what was available at the time. I was like, boom, Pfizer shot, come back in 21 days, get my second shot. And I was fine. The first shot laid me out, slept for like 2 days. I was fine. The second shot, I'm going to give you some urban legend here,
Okay.
knowing full well this is a doctor's show, right?
Okay.
I heard I heard that if you like ate a really good, like a really heavy meal, like with a lot of meat in it, almost like, you know, when you recover from surgery or something, your body needs all the extra calories to try and heal you. That if you went and had like a heavy meal or something after you got the shot, you'd be okay. So I got the shot and then I went and got like a bacon cheeseburger and some fries, mostly because I wanted it, but also because it was a good way to get in a lot of calories. I was totally fine. And so I cannot say that that is what happened, but I can say that I was good after I had that burger, like a couple hours after I had my shot, and a lot of water, everything that they were telling you to do.
Right.
Other than that, no real like side effects or anything. But I heard you mention earlier, you know, why should we trust medical professionals? And for me, this was similar to, and this is just my opinion and just the way I saw things. There's a lot of things that people ask us to believe in with no sight. You know what? It's faith, right?
Right.
You believe in God. You believe in science. You believe in a lot of things. I believed that the people that developed these vaccines wanted us not to die. So if I was going to play the odds, I'd rather play with the house versus be on my own. And so I decided, you know, if I take the vaccine and there are side effects that we discover 20 years from now, I'll be part of that class action lawsuit when it happens. But if not, I'm protected for now. This is the best decision I can make with the knowledge I have at the moment. Gotcha. And so that's why I took the vaccine back in March. And I lost 5 pounds. Now, it has nothing to do with taking the vaccine. It has everything to do with the alleviation of stress, because I'm a stress eater. Has nothing to do with the hamburger, but I'm a stress eater, and I felt better. I felt more able to go outside. I still wearing my mask, even to this day. Still, I have alcohol gel in every purse that I own, wherever I go, some in my pocket, some in the car. So I'm still protecting myself and others, but I feel a little bit better. I'm feeling brave enough to go sit outside at a restaurant, feeling brave enough I went shopping the other day for the first time in like 2 years. It was amazing. And so that's been my experiences. It made me feel secure. Even if it was a false sense of security, it was there and it made me feel better. I hope that was a very long answer to your question.
It was, but it contained a lot of elements. But I think the question I do want to ask you is, there has been a lot of emotion in terms of people that are anti-vaccine.
Mm-hmm.
What do you think is really fueling that emotion against the vaccine? Do you think it's partially fueled by some of that historic evidence that we talked about with Dr. Cooper and others on this program? Or do you think it's just this current distrust of whatever the government systems or whatever? What do you think is fueling that vehement kind of emotion against the vaccine?
I don't, okay, so I know we're on blackdoctor.org. I don't think the resistance to the vaccine is race specific. I think the reasons that different races say they don't want to take it might be specific, but overall, from a humanities standpoint, I think people are resistant to this vaccine in certain pockets because it's admitting a vulnerability. And humans like to think that they're invincible, that they can overcome, that they can just, eat right and work out and everything is going to be okay. And so there's this desire to believe that outweighs the evidence that they see, which is why people are calling it a hoax. That was a coping mechanism. You cannot fathom that you might die just from walking into a store. And so I don't believe I don't believe it. I don't see it. Never mind, you don't see air, but still, I don't see it. So it's not real. And it's just something that the government made up. Now, I will also say that the machinations of not only the American government, but a few other high profile governments across the world to engender distrust with the populace has added to that. So people don't know what to believe. I mean, 1984 became prophetic in a very real way in the last 5 or 6 years. And so people are like, I don't know.
You mean the book 1984?
Yes, yes, thank you.
The book 1984. I think that's George Orwell.
Yes.
The book. Okay. All right. So just want to kind of give the context. Yeah, look, I know a little something. I know a little something. So yeah. So I just want to give our audience context. You just threw out 1984.
I just threw out 1984, right? Like,
no, that's when the brother came out. What you talking about? No, we're talking about the book 1984 with George Orwell.
Right. Right. But this idea of not being able to trust the government that is supposed to be there to protect you, it leaves you feeling very vulnerable. And so I think people are reacting to this loss of control. We understand, to some extent, we understand cancer, but that is still something that happens to other people. And then there's a chance that you can survive it. There's treatments, there's et cetera, et cetera. And we've learned to cope with that over the decades, since we were able to diagnose and treat different types of cancer. Infectious diseases is always some other country, right? Not here, not in the US, right? And so now we have this thing that is on our doorstep that has been brought in from multiple sources that is hitting both coasts at the same time. There's no escaping it. And so you escape in your mind. I just don't believe it. And I think that has fueled a lot of the resistance, is just this feeling of hopelessness. So I'm like, I'm just going to abstain from even thinking about it,
Abstinence is
which is why you see, like, in my hometown of Houston, Texas, why you see the line to the turkey hut, like, wrapped around the building, because people are just pretending that it's not happening because they can't cope with how serious it really is.
That's a good point. So I'm going to bring back all of our other guests as we get close to the end of this program. So I think everybody's touched themselves up and got their water and everything. So we are good to go. So, wow, this was an incredible discussion. I just want to say that out the way before we start getting into it. But there was a couple of things that came up in terms of one of the things, and I'm going to throw this out there from our medical professionals in terms of really going back to that subject of the vaccine versus COVID. And there's been so much emphasis placed on, we don't know the long-term implications of the vaccine. We don't know the long-term implications of the vaccine, but nobody in the media really is talking about the long-term implications of COVID. So can we touch on some of those symptoms and some of those things that we are even seeing now and are still just kind of getting a grasp on what it means to, even if you've caught COVID and survived it, what does that mean for your health going forward? Dr. Woods, we'll start with you. I don't want to. You're on mute. There we go.
You already touched on the long hauler syndrome, but I'll say we really don't know what those long-term effects are going to be. We haven't gone through a full cycle, if you will, say a seasonal cycle of this pandemic. So I think it's a lot of questions, but the key here is the symptoms that many people have had, like loss and taste of smell. Some people have not regained that sense. We do have, from a gastroenterology perspective, having diarrhea. We know that's a transient symptom, and we haven't seen any long-term effects of say, infectious colitis or inflammatory bowel disease. But as we know, for those patients or those on this video or watching this video that have this unfortunate condition, we actually don't know what causes that in the first place. It is some type of interaction between your body and the environment. So I think, at least from a GI perspective, and I'll let my colleagues and other subspecialties talk about what they see in their practices. But right now, we're not seeing, or we don't have enough information right now to know what to expect from those patients who have recovered.
Dr. Brown, you are a pediatrician, so if you have a child that has contracted COVID, survived it, and they're still developing, do you think that could have some implications on their kind of full development as they're moving towards kind of full adult maturity?
Yeah, that's a great question, Ellis. We definitely are seeing long haul also in children. At least 10% of kids who get, COVID end up with long haul. And this is definitely being studied a lot more because we're not sure exactly how long these symptoms are going to last. And the other post-infectious complication of COVID in children is MIS-C, which is an inflammatory disease where they get very, very sick. And so there have been over 3,500 cases of that. And 1 in 100 children who get MIS-C do not survive it.
Oh,
And
wow.
so we have to be really careful when we talk about COVID and children. It is not completely harmless. And we also are seeing that post-COVID, you can also develop very rarely diabetes, type 1
Wow.
and type 2. So it's something that we really have to look at. And of course, I'm sure Dr. Erica will talk about the mood disturbances, right, that can also be brought on by COVID.
Dr. Erica, she passed the mic. We got.
I appreciate it. I will take said Mike. I think from my purview, there are a couple things that are really indicative that can be very difficult over long term. One is the mood issues as far as anxiety and depression, given that those have shown increases, and they're still trying to really get an idea of how much is partially related just to the situational and stress of it versus how much is the biochemical changes that are happening with COVID. But the other thing we haven't really touched on is there are some cognitive problems people are having with COVID. The lay term is brain fog. So there is a lot of brain fog, and that's also being shown with the long haulers. And they're seeing some uptick also in some dementia-like symptoms at times. So this basically just means people are not able to think as clearly or be as mentally sharp and have the same mental capacity. And those kinds of things can have huge implications, just as the mood as far as depression, anxiety, and even almost PTSD like symptoms from the experience of having COVID and just also feeling like they might die or being in the hospital or intubated for long periods of time, is that it can have definitely a long-term mental health effect. And if people are having a lot of these issues with brain fog or just some type of cognitive capacity issues, then that means it's hard for you to do your job. It's hard for you to organize your tasks. All of you out there that are parents, you know how many things you have to do to not only take care of yourself, but get your kids ready and do every single thing for your kids. Is that if you can't organize your tasks, think clearly, and remember things, then you also start losing function with a lot of the things you have to do around the home. So they definitely have some significant long-term implications. And I think it's going to be huge that people continue to stay tied in with an entire healthcare team that includes people to take care of the physical part of their vessel along with their mental health.
Dr. Cooper.
Sorry about that. I wanted to unmute myself. We got the entertainment district down here is getting revved up on a Thursday night. But the post-COVID syndrome, and there's quite a debate in the American College of Chest Physicians, Society of Thoracic Surgeons, American Heart Association, a number of others, about reclassifying this and getting away from long haul terminology, because it's a real syndrome. And what is being looked at is trying to classify this in terms of the degree of various organ dysfunction. You heard Dr. Goodwin speak about the brain fog, and I talked earlier about long-term problems with respiratory system, in particular pulmonary hypertension that can lead to heart failure. We've seen the effect of COVID on a long-term on people who have already existing congestive heart failure, the clots that I talked about earlier, post-phlebitic syndrome. And so there's a real push to try to put this into a real classification system. One, there is no DRG for long haul syndrome. There can be a DRG based on organ dysfunction. And so when we start talking about, the real subtle things that impact not just African Americans, but every person who is affected by this going forward, how are we going to cover them? Because the fact of the matter is they're going to have more heart issues. They're going to have more lung issues. We're already seeing it. We see, we see now the patients who would perhaps been controlled with congestive heart failure with just the usual medications. We're seeing that now being very, very difficult to control. And even the rapid progression of congestive heart failure and ejection fraction, that's the pumping action of the heart. So I see that every day in my practice. And so we're seeing people that have, that I would normally not have to operate on for any particular reason, that now they're coming back much sooner in the disease process, in their existing disease process because of coronary atherosclerosis and other conditions, because now they are 3 or 4 months out from COVID, and they're seeing this rapid escalation of the disease. So it's really important for patients to understand that if you have these chronic conditions that puts you at higher risk for getting COVID, and you got COVID, then it's very likely that those chronic conditions are going to be exacerbated for a very long period of time. And we don't know what the end game really looks like, but we do know, quite frankly, that a number of those people, large percentages of those people, are actually seeing their high blood pressure, their congestive heart failure, their respiratory symptoms being much more difficult to control. And then some of them, quite frankly, Ellis, we can't even figure out what's going on with them. They're short of breath, they're having chest pain, they're fatigued all the time, and we can't even put them into a real diagnostic category because all of the objective tests that we would normally do are basically coming back normal. So what are we missing? And so that's why I think it's very, very important for us to rapidly get to a point where we can classify post-COVID into its various components and really begin to define it by organ system involvement. That's going to be extremely important, not just for people being able to get covered through insurance, but also for us being able to sort of monitor and follow these people over time longitudinally, so we know how to treat them down the road. So it's a real problem, and we're seeing it in acute care settings, which is where I work every day, in intensive care units all the time, and we're really struggling to get our arms around it.
You make up a very good point, and one of the things that I heard on a previous program that I hosted, and they talked about having to list COVID as a pre-existing condition when you're going in and going to see a professional. And so when you think about that, you think about the implications that could have on your medical insurance and your life insurance going forward if you have to list having COVID, even if you survive it, as a pre-existing condition. And so that could cause your premiums to go up or cause you to be denied specifically because they know some of the things that you're talking about, Dr. Cooper, is that the complications that are coming from COVID, they're like, hey, look, we don't want to take on that expense. Because insurance is all about the numbers. And so if the numbers don't bear themselves out, you might not be able to get covered. And so we got to really kind of think about that going forward. If you say, hey, look, I'll trust in it, and I know I'll survive because it's got a 90-something% survival rate if you catch COVID, but those that do survive don't have the same life that they did before they had COVID. And so we've got to be very, very cognizant about that. So I love this conversation with you all. You all are probably, I want to speak.
I want to bring
my last comment. One of my last comments.
Sure.
Last comments, because I know it's kind of noisy over here, but did you all have an opportunity to interview Kizmekia Corbett?
Yes, she's been on our program before.
Good. I mean, she's a Black woman, and she was at the heart of the development of Moderna.
Right.
And I really love to hear her talk, because she really talks about, in a very, very profound but very simple way, how this was developed. And I think more and more people need to really hear her speak about this, particularly somebody who was right, Dr. Fauci says, is the reason why we were able to do this in such a short period of time. An African-American woman.
Absolutely. And yeah, so we've got some videos on we've got a COVID resource page. I'm going to do a shameless plug for BDO right now. So we have a COVID resource center on our website. And if you just go to bdo.org/COVID or COVID-19, it'll take you to our COVID resource page. Or you can also go to our YouTube page, and there are videos of Dr. Corbett talking about this particular topic of the development of the Moderna vaccine. So Joy, you had something you wanted to say?
Yeah, I just wanted to speak on, again, coming back to the Black community and the perception that I have, I don't want to cast any aspersions, of people wanting to avoid going to the doctor for fear of what they're going to find out. Now, if you exacerbate that by saying that if you have COVID as a pre-existing condition, it could affect your health insurance, I could envision people wanting to just get through it on their own with like saltine and ginger ale, trying to cure themselves. Yes, I said it. I said
Right.
saltines and ginger ale, but you know what I'm saying? Like, it treated like a cold, I can get past it, 90% recovery rate, not understanding the ramifications, the long haul down the way, what they are doing to themselves for fear of raising a premium or not wanting it to be on their record or whatever. That could be a factor that we maybe haven't thought about, how people are going to want to not say they have it. The same way people want to admit they have other diseases that are transmitted socially. It could be a similar problem if people feel like I can just get through it on my own and keep it on the low. And next thing you know, they have lung issues or heart issues that no one can explain. That is a much deeper issue than if they maybe had gotten treated for COVID earlier. Just my 2 cents.
You bring up a good point, and we didn't even talk about monoclonal antibodies and all those other things tonight. But we just ran out of time. We had such a great topic and great discussion. So I'm going to go around and everybody kind of give your final thoughts for tonight's discussion, because I promised you an hour and we're already over an hour. So I'm sorry about that. But you all were such great guests that I just wanted to really to give you the opportunity. So we'll start in the order of appearance. So Dr. Woods, final thoughts.
Thank you again. I urge everyone to get vaccinated and also go and activate your say God-given talents and use common sense and be screened for all those preventable diseases that you may or may not have. Thank you.
I like that. Dr. Brown.
Certainly, as the pediatrician, I'm going to say vaccinate around your children. If they're under 12, the recommendations have not changed. They need to continue to space out from others, continue to mask up. And if you're 12 and up, we definitely want you to go get vaccinated, and certainly before you head back to school.
All right. Dr. Cooper.
I want to encourage our healthcare community, our physicians. I don't need to do that to this panel, but we need to start talking. We need to really continue to have these conversations with our patients. And this goes not just for Black doctors, this goes for everybody, every doctor. For us to be able to ultimately get to a point where patients are going to trust us, we got to seem human. We've got to break down this wall of sort of, we're here and you're there. And, my blood is just as red as everybody else's. And so I really encourage Black physicians, white physicians, young physicians in particular, to really establish that connection. And these types of platforms, social media and others, give us that opportunity. And stop being afraid to be who you are. But when you get to that authentic self for yourself, get to that authenticity with yourself and get comfortable with who you are, then you can really find an avenue to your patients to really, and it's not about, convincing them or any of that. It's about really providing them with that support that they need. And oftentimes what you'll find is that what they really needed was just to have you be there and be, that person who's going to say to them, this is okay, man, this is all right. You're going to be fine. But keep having that conversation, keep putting that message out there. And so I want to encourage physicians and healthcare professionals to let's do our part beyond just sitting in exam rooms and really start to have real authentic conversations with the people that are around us and encourage them as best we can on every platform that we have, church, wherever it may be, to do the right thing, which we feel like is the right thing, is getting vaccinated.
All right. And Dr. Erica.
This pandemic has been a season that for a lot of people has been marked by loss and grief. And it's very important that I know you have been stretched to your emotional and mental capacity. And the last words I would give is simply, if you feel like you don't feel like yourself, or you're feeling overwhelmed, or you feel like getting out of bed is a chore, or you can't do your job, or you don't even feel like showering, or you just feel miserable, don't be on the struggle bus suffering in silence. Go ahead and get some help. There are plenty of us out here that are specifically trained to listen to you and whatever you have to say. And one of the things that just hurts my heart the most is when people are struggling with their mental health unnecessarily because they felt uncomfortable getting help. So I just urge everyone that if you or anyone you know is struggling, which is happening for so many people,
Mhm.
to go ahead and get some help. Don't wait until it becomes an emergency. And thanks for having me.
Thanks, Erica. And Joy.
You know, as the only layman on this panel today, I want to remind you of something. You know, when your car is broken, you take it to a mechanic because they've studied cars and they know more than you. When you are having a crisis of faith, you go to your minister because they've studied theology and they may know more than you. And so when you have an issue with your health, you should listen to your doctors the same way you listen to a mechanic, you listen to your personal trainer, you listen to your pastor, because they know more than you, because they've studied this. And so, as you've heard every doctor on this panel say, you should potentially trust the vaccine because it's in your best interest. And so that's as a layman, that's what I'm saying. I'm going to listen to the folks that studied this.
Well, that is a great, a great point. I just want to say thank you to all of the panelists today. This has been an enriching experience, even for me. And I've done a great many of this. I'm going to be completely transparent. This is the fifth or sixth panel that I've done, and I think every time, what I love about doing these panels is I learn each time, and I become more encouraged by the healthcare professionals that are out there. But we do have to do more. I echo the words of Dr. Cooper. Doctors do have to listen. They've got to listen more. They've got to be more empathic with their patients and with the community. We do need to trust that we need to protect our children. So with Dr. Brown, we've got to protect our children and understand that it's not all about us, and protecting them sometimes means getting them vaccinated and sometimes doing some things that are difficult. I echo Dr. Erica. Please, please, please make sure you are there 100% mentally, emotionally, so you can be the best person for you and your family. Especially if you're caring for others, if you're not 100%, you cannot be 100% for them. And that's not good for you or anybody that is in your charge. And also look at the words of Dr. Woods. Look, we don't know. And it's okay to say we don't know. And we don't know the future, but we know the best thing right now is for people to be vaccinated. But you've got to get information from trusted sources. So we encourage you to go to blackdoctor.org and make sure you get all the information that you can so you can make an informed decision here in the state of Georgia or anywhere across the nation, so we can get back to some semblance of normal life. Again, I want to thank all of our guests. And before we leave, we have one more thing I need for you to do. If you have been watching us, and those, thank you for staying with us tonight. There is a questions that we want to ask. We want to get some feedback from you. So if you could just drop this in the comment section as we end this program. Which speaker resonated with you the most? What information was most helpful for you? And did this event help you feel more informed or confident in making a vaccine decision? So your input is very important to us. So we'd like for you to leave that in the comment section, and so we can make sure that we provide the best and the highest quality programs for you to get the questions answered that you may have about this or any other decisions you may have. So again, as we sign off this evening, thank you all for joining us, and we look forward to seeing you again in the future, healthy, wealthy, and wise. Thank you.